So, good day, sir. I am Lesdan de la Pasion from BSN 22 Group 2. So, for today's video, I will going to demonstrate the application of cold therapy. So, before we proceed to the procedure, let us know the purposes of this procedure. First is to slow and to stop the bleeding of the injury or the wound. And then next is slow the bacterial activity in clients with infection. And then next is prevent peristalsis in client with abdominal inflammation. And then for the preparation, let us assess the patient. Identify the patient using the two identifiers. So, good day, ma'am. I am Leslie Andela Pasion, your student nurse for today. So, may I know what is your name, ma'am?
Jenalyn de la Cruz.
And then, when is your birthday, ma'am?
February 1999.
Okay po, very good. And then next is referred to healthcare providers. Provider's order for type, location, and duration of the application. And then preferred hand hygiene. Provide the hand hygiene. Inspected the condition or affected part and palpate the area for edema. Saan po yung injured po niyo, ma'am?
Ito po.
Titignan po natin kung nasaan ay kung meron po bang sign ng edema. For my findings, there is no edema yet. And then next is considered time elapsed since the injury is occurred. And then ask patient to describe severity and character of pain. Ma'am, gaano po kasakit yung pain na nararamdaman niyo po sa injured po na kamay po ninyo?
Saka lang po sumasakit kapag po nagagalaw.
Okay. And then next is perform neurovascular check, and then inspect the surroundings of the skin for integrity, circulation, color, temperature, and sensitivity to touch. And then next is review the medical history for condition that cumulative use of cold therapy. And then next is assess the patient's LOC and responsiveness. And then assess the patient's understanding and awareness of the procedure. And then next is for the planning. Identify the expected outcomes. And then next is for the implementation. Provide privacy to the client, and then perform hand hygiene. And then applied clean gloves. And then position the patient properly, expose the injury of the client or the patient, and then properly drape the patient. And then next is place the towel under the client's injury. And then for the apply the cold compress, place the ice water in the basin and lower the temperature. And then next is submerge the gauze into the basin, and then wrong gauze exposed. And then next is apply the compress to the affected pain of the injury, and then remove and then remoist again, and then reapply to the injury. And then for the next is applied ice pack or the bag. Before applying the bag or the ice pack, we need to fill the bag with water and then secure the cap. Next is empty the bag or empty the water, and then filled the bag properly with ice chips or ice chips and water. And then remove the air. And then squeeze the ice pack to remove the air. And then next is wrap the ice pack to the client's injury, and then secured it with the tape or towel. And then next is for applying the commercial gel pack. Assuming that this is the commercial gel pack, and then we remove it from the freezer and secure it with towel. And then place it to the injury of the patient, and secure it with the tape or the gauze as needed. And then next is apply the electrical control cooling device. So assuming again that this is the electric control device, so prepare the appropriate the device, and then ensure all the connections are intact to the cool temperature, and then wrap the cool pad around the body of the patient. and then turned on the device to the cool temperature. And then secure with the towel or tape as needed. And then next is remove the gloves and apply alcohol for infection control. And then check the um, check the electrical cooling device, and then stop if the patient feel the pain. Kamusta naman po, ma'am? May nararamdaman po ba kayong pain nung nilagay ko po yung electronic control?
Wala na po.
Okay. And then we remove the electrical control pack. And then next is apply use alcohol for infection control. And then apply clean gloves. And then remove the compress to the or pad to the appropriate time. And then dry the moisture. And then next is help the patient to a comfortable position. Ma'am, gusto niyo po ba tumulong? Para po mas comfortable po. And then next is remove and dispose all the supplies, and then empty the basin and dry it. And then next is for the evaluation. Inspect the affected area for integrity, color, temperature, and sensitivity to touch, and then reevaluate the appropriate interval, and palpated the affected area for edema, bruising, and bleeding. And then next is ask the patient to report the pain level, and then ask patient to demonstrate how to apply the ice pack, and then identify the unexpected outcome. For the recording and reporting, recorded procedure and patient's response in the appropriate log, and then documented the evaluation of patient or the caregiver learning. And then lastly, reported any sensations of burning, numbness, or unrelieved skin color, changes to healthcare provider. So that's all for the demonstration of application of cold therapy. Thank you for watching.